I am Stephanie P. Wachika, student at Walden University, doing a presentation of HIV and AIDS epidemic in the African American community in Mecklenburg County. I will do an introduction of HIV and AIDS. HIV is human immune deficiency virus. It's a virus that destroys the immune system, which prevents the body from fighting opportunist infections. It is spread by sexual contact with an HIV positive person. Diagnosis is with testing saliva and blood. There are symptoms like flu, fever, cold, sore throat, and fatigue. If untreated, it goes asymptomatic for months, even into years. CDC reported there are at least 37,000 new HIV infections since 2014. They also estimated roughly 1.2 million people are living with the virus in the USA. AIDS is an acquired immune deficiency syndrome. It is caused by the virus. It is the most advanced stage of HIV infection, and this is where your CD4 blood results show less than 200 cells. This is a medical condition. There is no cure. There is no cure. Boundaries. I did my study on the Greer Heights community, which is minutes from downtown Charlotte, in the zip code of 28205. It has an elementary school and a community center. This historically Black community was purchased by a former slave, and it thrived until 1920s, until Arthur Greer bought about 100 houses, and it became an unofficial suburban for Black soldiers, laborers, teachers, and postal workers. Greer Heights has an estimated resident population of 3,100, which are primarily African American, Vietnamese, and Hispanics. CDC facts. Roughly 1.2 million people in the U.S. are living with HIV, and half are unaware they are infected. In 2010, roughly 50,000 new infections occurred, which is 2/3 of cases since 1985. HIV exists primarily in the urban areas, which makes up of 82 of reported cases based on a population of 500,000 or greater. This is very interesting. Black women account for 11% of HIV diagnoses in 2015, and it has increased to 61% in 2017. Mecklenburg County did a study in 2015. It showed African American women represented 79% of HIV diagnoses. That is a lot. Let me repeat that. African American women in Mecklenburg County represented 79% of HIV diagnoses. 5,300 people are living with HIV or AIDS diagnosis. The zip code that they found that mostly affected by this infection range from 28205 to 28215. 51% of HIV is prevalent between 45 and 64. 39% range from 25 to 44 living with this virus. Greer Heights community assessment that I did is the zip code of 28205. The results of this community assessment: signs of decay, which are older homes that needed repair, litter, vacant lots. The community had 86% white-collar workers, 14% blue-collar workers with a median income of $25,100. That is poverty or below level. Social determinants are poverty, lack of education, and as I mentioned earlier, low income, limited access to healthy food alternative, and this we call food desert. That means this community is surrounded by fast food, no open air markets, no gardens, no access to fresh vegetables. If anybody needs to get these items, they must get on the bus system, which is the limited transportation for this community. Also, due to the fast food that surround the area, there's lack of job opportunities. Limited access to health care due to insurance, transportation, and also stigmatization. Some conservative religious beliefs are held by African American community are also a barrier to effort channel at reducing the high rates of infection among African American women. Another thing is the community has healthcare services like the Mecklenburg Health Department, Social Service, a Nuvia Detox Center, Carolina Medical Center, a mental health, and also a family services, which called Thompson Family Services. This is CMC healthcare system, which is right outside of the community. It's one of the largest healthcare systems in Charlotte and in the North Carolina. Anuvia is one of the largest detox facilities in Charlotte, North Carolina, and both of these are located within the Greer Heights community. Evidence-based primary prevention. Patient-client education. Also, encourage HIV testing throughout Charlotte. This is free. Raising awareness through social media medium. Supporting prevention programs, substance abuse and mental health treatments, free access to male and female condoms. Also, there's biomedical prevention method. There are two of them. The first one is pre-exposure prophylaxis, PrEP. The second one is post-exposure prophylaxis, PEP. So there are two biomedical prevention methods that's out in the market today. PrEP, which is PrEP, and PEP, PEP. My short-term goals were or are identify target population, create survey and questionnaire, and design educational workshop. The long-term goal is to decrease rate of new infections, increase the use of antiviral medications. I have with me a community advocate. Hello, Dr. Priscilla Joan Akpaita. She is an educator and advocate for disadvantage and health disparity in the African American community. Also, she's a founder of community outreach for young adolescents and adults in the Greer Heights community.
I feel very privileged to be able to sit in and listen to this presentation. I've learned so much about the the zip code in which I live, 28215. I had no idea that we too were an area that needs more education about this dreaded disease. So thank you, Stephanie, for letting me be a part of this today.
Thank you. Some of the positive social changes as a healthcare provider. I want to promote educational workshops and seminars related to HIV and AIDS, volunteer clinics, community centers, and schools. Be an advocate, supporter of political issues for individuals without a voice. Also, continuous professional development for myself and accountability, individual health versus population-based health. Summary feedback. Feedback from Dr. Priscilla. Recommended graphic inclusion for greater impact with dates. Limit information on slides to bullet versus sentences. Focus on grammatically structure. She also said it was well organized, well thought out, with sufficient details, sufficient slides for presentation. What I learned as a student during this PowerPoint presentation and my community assessment is to read, write, and review professional medical journals, how to develop scholarly writing with AP format, how to create a data chart, which she recommended for this PowerPoint, how to create a basic PowerPoint presentation, how to record and upload a video, how to do a detailed community assessment, and also do a critical thinking when organizing a presentation. Example of a graphic slide that she suggested was 2. HIV rate of new infection per CDC, and it shows in 2010, which is 2/3 more cases than were in 1985. That is a significant increase, and it mostly affected African American women. I have, after this PowerPoint presentation, presented or have reference, and you can refer to it later. I want to thank you for looking at this PowerPoint presentation. I feel privileged in doing this. I have learned a lot, and I will take what I learned from this and further into my nursing career. As I say, I am Stefani Porter Wachika. Bye.